trying to use an electronic health record to access his visit notes and complete them in a quick time frame. He wanted to use electronic billing as well to avoid the overhead for paper records. This doctor wanted to spend more time with his patients and focus on the quality of his treatment. He also wanted the neat features that included patient safety, as these were important to him. These are the reasons why the doctor wanted the electronic health record system.
Stupid system, paying thousands of dollars for it, and I still have to use pens. What is this?
I understand why the doctor purchased the software. Today we have the doctor with informatics training that joined the team a few years after the solo practice started.
So when you first joined the team, what were some things you advanced or changed?
The first thing I did when I arrived with the team was to update the current software to the newest system so that everything would be working the way that it's meant to work. Second thing, I tried to encourage more training for the staff so that they could achieve the original goal of the practice of not using any paper. And currently they were still using paper for the EHR system to do. Another thing I wanted to see was more security with the system so that not anybody could be logging on with the administrative passwords. The system is more advanced than what they were using at the practice. I just wanted to get them to take full advantage of what they paid for and make sure the practice worked as well as it could.
These are definitely concerns that a healthcare organization should worry about.
We also have the doctor who started the practice with us here today. Do you agree with these suggestions, Doctor?
I do. I understand that the software had many capabilities, but for what I wanted it to do at the moment, it was perfectly fine. I am very pleased, and down the road I look forward to getting more training and to advance my knowledge of the software.
Excellent. It seems that having a health informatics expert will be valued in your practice, and in time, the software will become more useful than its original intentions than you had when you were purchasing this software.
Mm-hmm.
Here today.
No problem. Thank you.
While looking for an EHR system, I came across a guide on how to pick an EMR. The EMR pre-implementing guide was published by Canada Health Informatics, and it focuses on 5 major areas: contemplation, leadership and commitment, solution provider and system support, preparation and readiness, and managing change. Contemplation deals with clearly getting your vision across to your team and making sure your office team culture is open to change. In my case, I had a clear vision to run a solo practice while using an EHR system to avoid using paper. It would also make it more efficient to bill my patients. Leadership and commitment talks about having a team leader or project manager to champion every step of the implementation and make sure your team is committed to change. In our facility, there was no project manager until a few years later when I hired a physician with a training in health informatics, which was greatly beneficial to our establishment. To pick the vendor that will supply your EHR system, you have to identify your office requirements and discuss the pros and cons. Most importantly, it's recommended to scout ongoing support and maintenance resources required for your EMR once implemented, as discussed under solution providers and system support. This was another problem we encountered because I did not keep the system up to date. Preparation and readiness refers to making sure your team is properly trained to use the EHR and to have a project timeline to ensure the success of the project. It's also a good idea to have a backup plan in case the system fails. My team was originally trained by the vendors who installed the system. Other than that, there was only one other physician who actually knew how to handle the system to the fullest extent of its potential. Finally, ensuring change management is extremely important. Making sure that your team is comfortable using the new system and knowing where to find help if needed will make the transition a lot easier.